Let's start with like the basic terminology. So what is an anxiety attack and what is a panic attack?
Thinking of panic first, that has quite a clear definition. It's characterised by the symptoms of adrenaline, where you get shortness of breath, palpitations, tingling of your fingers. Patients often feel that they're going to die and often will take themselves to A&E because they're not sure what's going on. The physical symptoms actually make you feel more anxious in itself, which makes your physical symptoms worse. So it's a horrible negative spiral, and it's really fueled by adrenaline. Anxiety attacks, there's no real established professional definition, but patients will use these kind of comments quite frequently. And what they mean is their anxiety has been triggered by a particular thing or no trigger at all, which has caused them to feel acutely anxious. Now, there might not be the physical symptoms that I've just described, but they do maybe feel incapacitated. I'd often put that to somebody who's really good at masking, for example. It's not going to a full-blown panic attack because they're able to keep it under control, but they certainly feel that rising anxiety.
So if we can sort of agree that maybe, an anxiety attack might be like a feeling of anxiety. It might, like you say, have a trigger linked to maybe a certain event, like a job interview, or maybe it doesn't. And a panic attack is maybe a much more intense sort of reaction to something. Yeah. And what are some of the common sort of generic symptoms of anxiety? And then we'll talk about the same for panic attacks.
So anxiety is a pretty awful feeling to have. It's an uncomfortable feeling where you're thinking generally about the future. It has a myriad of symptoms. One might be thinking of lots of different outcomes. It often picks on things that you're not able to really provide evidence for, or there's uncertainty in it. It doesn't pick something you can prove or disprove. It picks on things that there's an element of leeway, so you can never 100% reassure yourself. And that's what the hook is, essentially. So you can think of lots of different outcomes. That can be in the form of images sometimes. Some people have what we call intrusive images, where they see lots of negative things happen. Then there are the kind of physical side effects, which might be, as we discussed, the panic feelings, but also that stomach churning feeling. Sometimes you have increased bowel habit, for example, or loose stools. And some people are really not able to bring themselves out of these moments of extreme anxiety. So it can be incredibly disabilitating.
And what are the core symptoms and signs of a panic attack?
So the biggest one is shortness of breath, feeling sweaty, palpitations. Some people also can get some chest pain, tingling of the fingers, sometimes feeling lightheaded, tunnel vision, all the way through to some people can have fainting spells or very brief episodes of loss of consciousness. And it's really that kind of fight and flight response that's been triggered.
And do panic attacks have any discernible trigger or a cause? They
can do. They also might not. And sometimes the trigger is there, but it's quite something that you need to unpick with a psychologist. So there is something called panic disorder, where somebody's having repeated panic attacks with no clear reason for having them. There are also some physical causes of panic attacks and increased heightened anxiety. And really it can come down to a hormone imbalance that needs to be investigated.
Yeah, and you touched on there. So if I have more than one panic attack, does that mean that I've got panic disorder? And does panic disorder or panic attacks more generally, do they overlap with any other sort of common mental health disorders?
Yeah, absolutely. So panic attacks can affect lots of different mental health disorders, or it can be a symptom of many. Panic disorder is really when you're having these episodes of panic attacks and between times you feel quite normal and well. So that's really how panic disorder presents. Panic attacks can happen in any anxiety disorder. But really talk to your physician or GP about the panic attacks, what it might be, and what might not be. A lot of people worry in the midst of a panic attack that they're physically going to die, because that feeling of palpitations, shortness of breath overlaps with a lot of cardiac issues. So if you do have those symptoms, then it's always very reasonable to get checked out with a doctor or attend A&E.
Lots of people watching this video will probably want to know ultimately how can they deal with these sensations in the moment. So let's say I'm getting a rush of anxiety, maybe in the build up to a job interview or something similar, or I'm experiencing a panic attack, or I can feel a panic attack coming along. What can I do in the moment to help myself get through and lower that anxiety?
Yeah, absolutely. There's quite a lot of psychological techniques that you can learn to help regulate your anxiety. And there's also some medication options that you could consider. Then there's also the option of treating the underlying mental health illness. I'll go through these. So some of the psychological techniques that you could use would be grounding techniques. And what I recommend to patients is they try many different ones to find what suits them the best. So for example, box breathing. When you breathe in for a second, you hold your breath and breathe out for 2 seconds. That might be helpful for some people. Other people might find some mindfulness, maybe active mindfulness, to be quite helpful. All different ways to help them with the anxiety. I know some patients keep an anxious box where they put things that are able to help them, different textures or pictures of loved ones, for example, that help them be in the moment rather than being in the anxiety. Then medication options. So there's a couple of medication options that you could think about, and they're really classified into things that treat generalized anxiety or kind of a more anxiety disorder, but not necessarily the panic attacks. This would be something that you take every day that eventually starts reducing your general levels of anxiety, which hopefully helps stop the panic attacks, all the way through to something that you take in the moment, a kind of pill in the pocket that you're able to carry with you. And really what suits you is up to you as a patient, and sometimes people like a combination of both. So absolutely talk to your healthcare provider about what would be the best. And then there are psychological treatments for this. The gold standard for typical anxiety is CBT, and it has the most evidence-based and is the most effective, typically for things like OCD. The problem with anxiety is it's very self-rewarding. So if you feel anxious, you avoid what triggered the anxiety, and that makes perfect sense. The thing is, walking away from the anxiety rewards you because you suddenly don't feel anxious anymore. And so avoidance is a key part and encourages more avoidance. So where CBT starts to challenge those thoughts is to stop avoiding those kind of triggers, but giving you the techniques to be able to deal with it.